Well, it's an interesting topic, and it's been really interesting to us, given the fact that COVID and the whole pandemic crisis has become for us a kind of kink point, and a kink point to see how we must rethink and reestablish social policy altogether and make a shift from what was happening until now, which was a solely passive distribution of social benefits, to the guarantee of these benefits together with the provision of a much more active social policy that, exactly as you said, activates people. Because for us, the way that the ministry works right now, for us, the way to unroot poverty is, of course, through jobs, right? So during COVID, we had the mandate, and to be honest, it was not just a mandate, it was the untouchable, unmalleable obligation that we had, that was to protect the most vulnerable. And this meant that we actually managed to do quite well and better, thankfully, than most of our European counterparts in protecting the elderly, protecting people with disabilities, protecting people with lower disposable incomes, and of course, protecting children that are in most need. But other than that, we had the opportunity to reform and think of how do you shift towards this, what we call more active social policy, a policy that at the same time guarantees the utility, to speak in more academic terms, but also the livelihood of the most vulnerable, the very poor, or the disabled, or people in higher ages. And at the same time, you do successful and effective social policy horizontally. So if you want, how at the same time you're able to combine both the Rawlsian model of maximizing the utility of the very vulnerable, of the worst off, and at the same time utilizing utilitarian logic, Bentham style, of maximizing the utility of the median. So we are focusing on these two fronts, the very extremes, the most vulnerable, and maximizing the utility of the average household. With regards to the first category, which is very important towards reaching the EU's anti-poverty goals as well, we have identified, and COVID has helped us a bit in this identification, identifying who are and who is the most vulnerable. We have to deal with institutionalized children, doing a lot with adoption, establishing, if you want, fostering in Greece, which was something that was not heard of, not practice, it was not heard of. People do not still know, even our efforts are big. I think people start to understand the difference between adoption and fostering, given the fact that most institutionalized kids now do have a family, so fostering is the only option for them. The very vulnerable being homeless. So for the first time, we gave the opportunity to homeless people to be able to be guaranteed the minimum income scheme. So homeless people that live in shelters, or women that live in shelters that were abused before, now they are the most vulnerable and they can be the beneficiaries of the guaranteed minimum income scheme. So from the one side, we have the enhanced protection of the most vulnerable, John Rawls. From the other side, we have Bentham. What does Bentham do? Increase the utility of the median. What are we doing there? Again, seeing how our interventions can be of most help to the median voter, to the median household. What do we do there? Enabling factors. Big reform in preschool education. Greece is, unfortunately, one of the last countries in the EU to enroll its kids to early preschool education, that is the ages of 0 to 2. We are at an average of 16%, while the European average is at 27%. And this is important to us, not just as an enabling factor that enables women to take their lives in their hands and be able to join the workforce in their own terms, but it's also very important for us to utilize the European Child Guarantee platform. So we believe that in order to decrease social inequalities and in order to eradicate this social cleavage of the extreme tails of income distribution, we need to give to children at the youngest possible age the opportunity to increase their cognitive skills at maximum and be able to build this kind of nurseries with increased funding, but also with structured programs. So we really believe, and we have heavily invested in preschool education. Equally, in the horizontal terms, and I'll mention two more reforms and then we can move on and also engage in the discussion so that I won't bore you too much. Equally, there are two more things that I think are of pivotal importance as works that we're doing. Giving, and that's what I mean, active social policy. We give to people, children in the beginning, the equality of opportunity in a kind of Amartya Sen kind of way. So equality of opportunity through nurseries, but also equality of opportunity through the personal assistant to people with disabilities. The piece of legislation that is going to be voted, I hope, today is on personal assistance to people with disabilities. It's not just about passive benefit provision to these people that have a disability and they cannot really live independently. It's also about providing the service. And when we talk about active social policy, it's all about providing services rather than granting immediately money. So service with regard to disability, service with regards to children, and also service with regards to incorporating in the labor force the most vulnerable. Who are the most vulnerable? They're also homeless people, and they're people with really low income. So people that do receive, as a result of their low income, the guaranteed minimum income scheme. So targeted, inclusive policies there that do encompass lots of specific training, and also subsidized for some time employment together with the tax wedge that we do subsidize for them, and also subsidized shelter, which smoothly will sort itself out so that what we've observed in a kind of progressive economic way, if you want, is that if you cut a benefit or if you cut a service immediately, then the viability of the inclusion policy is not going to last for long. So if we want to have sustainable social policies, we need to fine-tune the smoothing out of a grant from the state or of a service or of something financed as a provision from the state. So I'll wrap up saying that we have identified the most vulnerable, and we're moving with this two-tiered approach, reforming the provisions for the most vulnerable, for those in need, institutionalized kids, people in homelessness, and also horizontal, active reforms that do give people the tools, the services, rather than direct and pure income provisions.